Hi, I'm Dr. Mitra Motamedi. Last time I shared with you this most recent data that published by CDC, the US, that about 6% of adult population is living with ADHD. And we also know that up to 80% of these people are not diagnosed. So why is that happening? Today I'm going to talk about some challenges that we have for diagnosing ADHD. Obviously, at general population level, there is a lack of knowledge. I'm seeing adult people who were suggested to check for ADHD when they were a child. And their parents, now they tell me that their parents at the time were against doing anything about it, either because they were not agreeing with the idea of ADHD, they didn't believe in that, or they didn't want to label their child with a condition, or they didn't want to medicate their children, so they didn't pursue. I still see parents who have the same beliefs. So stigma is a very important barrier for diagnosing people. So ADHD diagnosis is not as simple as we think. The presentation changes in girls versus boys. So many people still think that ADHD means a boy who is running around all the time, but that's not it. There are children, boys and girls more than boys, that's why they are missed in diagnosis, who are not hyperactive, they are just inattentive. They may fidget in their place, but if you look at their notebook, it's all full of drawings and scribbles, their mind is wandering here and there, they are not present in their class, and they do struggle too. The presentation is different in childhood versus adulthood. The same child who has been hyper all the time during their childhood, when they grow up, they have an inner restlessness. They still have difficulty sitting in a 1 hour boring meeting or lecture. So the presentation in girls is different than in boys, and in children is different than in adults. Some people have hyperactivity plus attention issue. Some people have only inattentiveness. Emotional dysregulation, some people have it, some people don't. Executive dysfunction depends on how the upbringing is, can be bolder or less of a problem. So even at every individual level also, the presentation changes. So in mild cases, when they are able to live fine, when the pressure is higher or based on internal hormones or external issues, everything may change and they start manifesting symptoms of emotional dysregulation and inattentiveness more boldly. So these are some challenges to identify the ADHD and ADD and diagnosing this at general population level. When it comes to healthcare system, we obviously see a significant gap in training and education, and at practitioner levels, at all levels, we see that the training is not enough. So people seek help, they come to us, practitioners, and we don't even consider ADHD in the differential diagnosis. So we never get anywhere with that. There are not enough clinics, facilities, or practitioners who provide assessment and diagnosis and treatment at the same time. I believe that this whole package should be provided all at the same time, at the same place. Diagnosing more Severe cases may be easier because they are so obvious when we see them, but when they are mild cases like high IQ, high functioning individuals with mild ADD, they are very commonly missed. A problem that we have is that practitioners are very familiar with diagnosing depression and anxiety, and these adults with ADHD, or older children with ADHD, commonly present with anxiety. When they go to practitioners' offices, they go for anxiety and depression, and that's why I see many people are diagnosed with depression and anxiety, where the underlying condition, the ADHD, has been the reason for all these anxiety symptoms and depression symptoms. And when we treat the ADHD, those anxiety and depression symptoms go away. For childhood period, we also ask for report cards, but most of the times adults don't have their report cards. I see that a lot, that many adults have no connection with their families. So they don't have anybody to help them with their childhood. They don't have a sibling or parents, they don't have connection with them because of probably all this challenging upbringing and conflicts and abuse and all these problems that they have had in their life. They have no connection, or even in their adulthood, they are living alone. They don't have anyone to, or they don't trust anyone, or they don't want to share their issues with other people. So collecting collateral information is also not always easy. Presence of comorbidities is also very challenging. As a child with a simple ADD grows up, because of all the challenges that they have anxiety, and then they become depressed. At some point, if they are living in a chaotic environment, they may get some borderline personality-like behaviors. At some point, the comorbidity of bipolar is also very common after like adolescent and older. And as I said, they present to healthcare professionals with symptoms of anxiety and depression, and because they don't know about ADHD, we don't know about ADHD, so this condition can easily be missed.